So dear friends, we'll start with the aphorism number 97. Other individuals of an opposite character, however, partly from indolence, partly from false modesty, partly from kind of mildness of disposition or weakness of mind, refrain from mentioning a number of their symptoms, describe them in a vague term or alleged manner, allege some of them to be of no consequence. Few words one must understand from this aphorism. The first is indolence. Indolence means a laziness, आळशीपणा. False modesty. Modesty म्हणजे विनयशीलता, नम्रता. False modesty. खोटी विनयशीलता, खोटी नम्रता. Refrain. Refrain म्हणजे स्वतःला आवरणे, एखादी गोष्ट सांगण्यापासून परावृत्त करणे. अलीग. अलीग म्हणजे ठासून सांगणे, एखादी गोष्ट ठासून सांगणे. What he wants to explain over there, just understand. Other individuals of an opposite character. So the opposite character means in earlier aphorism, he has mentioned the persons who are hypochondriacs. Hypochondriacs gives you many data which is not also present, the false data. And exactly opposite are the people who will going to give you a certain entity which are reserved, which are secretive, which don't want to talk too much, which are taciturn, and these people will not give you many things. So other individuals of opposite character, however, partly from indolence. Why they never wants to? Because they either they are indolent. Indolent means they are lazy. They never wants to talk so much. They never wants to spend too much of time with the physician. They expect, yes, doctor, please give me a remedy. I'm having cough since last 1 year. That's all. They never talks much more. And you cannot get the details. How can you prescribe with homeopathy, in homeopathy, with the help of such a single symptom? And such peoples are very difficult to treat. So such persons where you don't get a data enough for the prescription, you cannot reach to the simillimum. And this is the state in certain patients. Partly from indolence, partly from false modesty. What is false modesty? Few people never wants to discuss certain things. They feel that why I should disclose these things to the doctor. These are my household things, my domestic problems. Why I should share them with him, or why I should share my personal things to the doctor. These are certain things which happens to be there with them. And these are the things because of which patient never tells you the things which are necessary for you, because they don't understand this is important for the homeopath. They don't understand this is on the basis of this the homeopath will going to prescribe remedy. They consider the homeopath will going to prescribe remedy only on his diagnosis, only on his complaints. And that's why, because of false modesty, they never wants to disclose their personal entities. So that is second reason because of which they never want to share with you. Third important thing, partly from a kind of mildness of disposition. Mildness of disposition. What is disposition? Disposition is the tendency of the mind to express inner feelings, inner things, inner feeling. So a disposition, if the disposition is mild, the person never talks so much. Whatever happens, whatever questions are put, he will going to talk either yes or no, or in very few words. He is the person of a few words many a times. And that's why he never wants to share. Certain peoples are there. Those who are not, what you can say, those who are not vivacious, those who are not active. And these people, whatever you ask, they ask in the answers in 1 or 2 sentences. Yes, doctor. No, doctor. That's all. They will going to talk in such a manner. And such types of cases, you don't get the data which is required for you. So these are the things because of which you never get what you exactly expect from the patient. Refrain from mentioning a number of their symptoms. So these people's refrain means they keep closed, never wants to open. And this happens many a times in your case taking. Many times you don't get anything. But there are few peoples where you put just one question and they start talking and you don't have to ask. Exactly opposite. The hypochondriacs, you get ample, which is not necessary. And in such types of taciturn people, you don't get anything what you want exactly. So these are two exact opposite poles where you should be cautious enough. So in such types of patient, it is too much important to understand all those things. So refrain from mentioning a number of their symptoms, describe them in vague terms. So these people always talks to you in vague terms. So you ask, what is your problem? Explain in me in detail. And patient talks. I am having IBS, doctor. That's all. Nothing else. Since last 10 years, I am suffering from IBS. That is the problem. Nothing else. So what is IBS? So doctor, they have given me diagnosis and this is my problem. Then in such types of cases, you have to ask exactly what is IBS, to what problem you are labeling by the name of IBS. Because they don't want to disclose exactly what a homeopathic physician wants. And that's why the vague terminologies are always comes. Doctor, I'm having pain in abdomen since last 10 years. That's all. I'm having migraine since last 10 years. Finished. You don't get anything. And this diagnosis is not of any use to you. Migraine is not at all important because you're not going to prescribe for migraine. You will prescribe for the patient who is suffering from migraine. You must want the details about the migraine. How is the headache? How it has started? Where it starts? What is its aura? Which are the things which aggravate the things? Which are the things which ameliorates the things? All things which you have to take into consideration. And then it works. Otherwise, it never works. So this is very important thing which one has to understand. And that's why these people always talks to you in a vague terminology, or alike some of them to be of no consequence. They only talks such a broad thing in a very strong words. Doctor, I am having this migraine problem. That's all, nothing else. They give stress only on word migraine. They give only stress on their diagnosis. I am having the liver cirrhosis. That's all. They give more importance to that word. But what problem the person is suffering from, he is not explaining. And this is the thing with such peoples. So you have to be very, very watchful, and you have to ask many details to this patient. In such types of cases, patients, you require, in fact, your art. You require your communication skill. You have to tell them in a proper manner that this, yes, what you are suffering, that I understood, but I exactly what problem you suffer. You don't label the disease. What are your complaints? Tell me in proper manner. Because patient consider that you are also prescribing for his diagnosis. They don't know that homeopathy never prescribes on diagnosis, but this thing is not there in their mind, and that's why they are always fixed with their thoughts. These types of patients where one should develop their art and communication skill to get the history. So this is exactly the opposite state which you can get in certain patients. So there are three varieties of peoples who cannot give detailed answer: the indolent ones, the second because of false modesty, and third because of the mildness of disposition. You cannot get a detailed case because these are the people who talks in a very few words. Question arises: if such types of patient comes to you, what you will going to discuss? You ask the patient details, everything, and patient is not telling you anything. Then what you will think? You ask him, what is your problem? Doctor, I am having headache. Can you tell me details of headache? Yes, doctor, sometimes it sometimes whole head is getting involved, sometimes one side, sometimes other side. Many times I get the head. When do you get it exactly? Anytime. Then you go on asking many questions, he answers in 1 or 2 words, that's all. He never gives you details what the core, where you can prescribe. Nothing else is coming out. So you poke the patient and every time he answers in such a manner. You put him any question, yes, 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 occasionally. No, that's all. This is the thing. So what you will consider? Then you have to think about it that this person is giving you something which is necessary for your prescription. You have to understand, you have to pursue him. So there are few things. First important thing, you have to consider why he is answering like that, whether it is his habit of answering in monosyllables. So you have a rubric in your repertory, answers in monosyllables. If you have Kent's repertory, you can open and you can find it out, the answers in monosyllables, and you have remedies over there. There are people who are taciturn. Taciturn म्हणजे मितभाषी, कमी बोलणारे. There are some people who are taciturn. They never likes to talk too much. They always answers in such a manner. So you can ask to the attendant, even in home he talks like this, and then their wife always explain, doctor, he never talks to me. That is their grief of his wife. This happens many times. So this is the generally when you take the case of males, this is a problem that they talks very less. This is the problem. So that also you can get. Sometimes some persons never wants to explain something or never wants to show it to you. The another rubric you can think about, the hide desires to be or hide things. That is third important thing which you can find it out with such personalities. They want to hide something from you. That you can catch on their face. They keeps it inside. That's why. Then how you can find it out that they are hiding something? Make a habit of keeping eye on his eye. Keep eye to eye contact. These people never keeps eye to eye contact if person tries to hide something. They looks down always. This is the thing. When they hide something, they always looks down and talks to you. They never looks into your eyes. That is very typical thing when they want to hide. They always looks down and they talks. This is very typical with the hides thing. There are some people they never want to disclose their secrets. And this happens many times. So secretive is another rubric, but it depends from one person to another person. The situations may be variable. In one patient, it might be secretiveness. In another person, it might be taciturn. In another person, it might be answers in monosyllables. In another person, it might be a patient is of a reserved nature. The person who is reserved, his nature is reserved. He always keep everything in inside. That is his reserve. Only when the time comes, he talks. This is quite common with the females. They keep things inside them, and when time comes, they comes out with that. That is the reserve. This is very typical with the peoples, or specifically female. So you have to understand that specific thing, and that you have to catch. So it doesn't mean that you are not getting the data for prescribing. You can get this is what is the perceiving. Even though the patient is not talking, why he is not talking, just understand what he wants to explain. And that is very important thing which guides you towards the thing. So 97 aphorism is related with the exactly opposite state of the 96 aphorism. In 96 aphorism, he explained one caution with the hypochondriac patients who talks more than what they suffer. And here exactly the opposite thing is there. We'll learn one more aphorism in today's session, 98 aphorism. So what he says over there, 98. Now, as certainly as we should listen particularly to the patient's description of his sufferings and sensations and attach credence. Credence म्हणजे विश्वास ठेवणे एखाद्या गोष्टीवर, to believe on someone, credence. And attach credence specially to his own expressions, wherewith he endeavors म्हणजे प्रयत्न करणे, wherewith he endeavors to make us understand his elements, because in the mouths of his friends and attendants they are usually altered and erroneously stated. Erroneously म्हणजे चुकीच्या मार्गाने, wrongly interpreted, erroneously. So certainly, on the other hand, in all diseases, but especially in chronic ones, the investigation of a true complete picture and its peculiarities demands special circumspection. Circumspection म्हणजे सावधगिरी, to be cautious. Special circumspection, tact, knowledge of human nature, caution in conducting the inquiry, and patience in eminent degree. See, last 4 sentences are very, very essential. These are few important qualities, more qualities which he has mentioned while considering the chronic case. Very important. Just underline all those last 4 lines are very important. Now what he explains over there, just go through that again. So what he says, now as certainly as we should listen particularly to the patient's description of his sufferings and sensations. So whenever we are learning, we are taking the case and we are understanding the patient, we go on understanding each and every word what the patient explains. We are concentrating on his history taking. The first person is always the patient himself, who is narrating all the things, whatever he is suffering from. He is explaining you sensation, he is explaining you location, he is explaining you all those things. And attach the credence specially to his own expressions, wherewith he endeavors to make us understand his elements. So person always tries to explain their things in a proper manner. He tries to give you expressions, he tries to give you gestures while narrating, and all those matters a lot, which are very important, no doubt. But here, 2 important things are there. You have to believe what the patient is saying. How will you believe? Here, your power of perceiving is very important. What the patient is talking, what the patient is saying, what the patient is explaining, you should be very watchful. And then think whether he is giving you details which is truth or false. You have to understand with your perceiving power. So he is the first source. Sometimes what happens? Sometimes the attendance gives you some history, but with the attendance, sometimes you miss few things. You never get in proper words. He endeavors to make us understand his elements, because in the mouths of his friends and attendants, they are usually altered and erroneously stated. So sometimes whatever is explained by the attendants might be wrong, because they know only superficial things. They don't know the reality behind the things. And this is second condition, which happens many times in case. So don't believe 100% only on the attendant also or observers also, because the reality behind that picture might be different, which that fellow is knowing. And that's why one part of case taking is from the patient himself, another part comes from the attendant, third comes the physician observation, and then you have to utilize all those things with your intelligence. And then comes the role of physician. Erroneously stated, so certainly, on the other hand, in all diseases, but especially in chronic ones, the investigation of true complete picture and its peculiarities demand special circumspection. So when you deal with the chronic cases, in such types of cases, it requires special circumspection. पहिली quality, first quality. What is circumspection? You should be cautious. What the data you are getting from the patient, you have to be careful whether he is giving you a right data or whether he is giving you the false data. You should be very, very cautious regarding those things. And that's why you must utilize your intelligence. Sometimes you get the information from the attendants. Again, you should not believe directly whatever the attendant is telling. It is the right thing. It is the truth. Again, you should be on your caution, so that you can find it out very easily. And that's why first quality which he explains, in order to furnish the complete picture and its peculiarities, demands special circumspection, tact. What is a tact? Anyone? What is tact? You use this word again and again. Tact म्हणजे काय? You have many tacts. If you want to miss a lecture, what do? You use your tacts. This is the thing. What is tact? Skill, yes, little bit related with skill, tacts. It is an art, it is an skill. Where exactly you want, you have to utilize your tact. Where do you want to utilize your tact? Patient comes to you. Patient has, you asked your attendants or someone who is taking the case, and he comes along with case taking, and patient has not narrated many things. He has explained, and in short ways he has explained the case. That's all. And now he is in front of you. But now you read that case and you observe that this is not a prescribable data. You cannot prescribe on the basis of that, because whatever the data you get is not a data which will guide you towards certain remedy. And patient has not narrated what you expect from him. So what you will do? Then your art comes, then your communication comes, skill comes, then your tact you have to utilize. So how will you use it? It depends. It varies from person to person. You have to explain to the patient first that what is the importance of it. Then patient will tell you exactly. Otherwise, patient will not narrate. If you, that is the very essential thing in case taking, that when you start homeopathic case taking, always tell the patient first that it is too important to take the case in detail, because their remedy depends upon whatever the real information comes from you. If you will not inform properly, your remedy might be wrong. That is the first caution you have to explain to the patient to start with the case. And if you do that, then it becomes very easy for you. Second important thing, that you should get so familiar with the patient immediately that patient will going to tell you all those details. That is the communication skill, tact, which you have to develop. Then whoever the person is, that might be a child, that might be a youngster, that might be an adult, that might be an older person, anyone, you should develop that communication skill, that you can get familiar with them with ease. So what tact you will going to use? How will you talk? How will you start communicating? What is the thing with which you can start your communication? What is the simple way? If the person who is there, who comes to you in front of you, consider that he is of your age, youngster, around 20-25, who comes, enters in your room, and you have to start. How will you start? What tact? Yes, Karuna has said that you must give the Karun smile. Yes, very good. Anything else? Smile is very important, because smile is one important entity through which you can start with the communication. It's very, very important, no doubt. That should be there always with on your face, even though it might not be a real, but you have to keep it. You should be a psychotic for that, but it should be, because that is Very essential thing. Anything else? Yes. To greet him.
So we can,
agreed. Yes, yes.
we can call him with his name or her name directly and ask
Okay. Okay. Ajun.
for the question.
Ajun. Anything else?
What you are doing nowadays? Like,
What are you doing nowadays? Okay, agreed. Anything else? Ask him, how are you? Yes, how are you? Agreed. What we'll do, because this is this tact, knowledge of human nature, caution in conducting the inquiry, and patience in eminent degree, all those qualities we have to discuss in at least 1 or 2 lectures. Tomorrow or day after tomorrow, 2 lectures we'll conduct on this. So we'll do that in tomorrow's session. Ask about the education, college, friends. Very good. You should make him comfortable. Very good. Anything else? Any ideas, new ideas? Because communication skill is the basic entity in the case taking. And that's what you have to develop. So tomorrow's session will be wholly dedicated only with the communication skill. We'll meet at the same time with this topic only of a communication skill. And those last qualities, and tomorrow's session will be sufficient for tomorrow's session. Hobby, yes, definitely, Hardik, but hobby comes later. When you have to start the case taking and you have to start communicating, how will you start? That is my question. There are many approaches, but few approaches which are needed, which are more practical, with which you can get very easily attached with the others. Any other idea?
Sir, what I do, I usually said के अगर उसने मुझे कोई रिपोर्ट्स वगैरह भेजी हैं और हमारी मुझे उसने अपनी कुछ बीमारी के बारे में बताया, तो मैं यूजुअली ये कहता हूँ कि जो तुम्हारी रिपोर्ट्स बता रही हैं और जैसा तुम बता रहे हो या बता रही हो, लेकिन तुम दिखते ऐसे नहीं हो, तुम तो बहुत अच्छा दिख रहे हो, मतलब यू लुक मच बेटर देन व्हाट वी हैव इन टेस्ट रिपोर्ट्स और व्हाट यू हैव सेड. तो वो एक उसके ऊपर एक बड़ा अच्छा एक, और एक चीज और मैं ये कहता हूँ कि यू विल बी फाइन और आप बिल्कुल ठीक हो जाएंगे, क्योंकि एक दफा ऐसा हुआ था सर कि मेरे पास एक पेशेंट आई और सिर्फ मेरे इतना कहने पे कि आप ठीक हो जाएंगी, तो वो रो पड़ी थी, क्योंकि उसने कहा कि मैं जितने भी डॉक्टर्स के पास गई, दे नेवर सेड दिस थिंग टू मी. तो ये मुझे एक बड़ा बूस्ट मिला था. तो मतलब छोटी छोटी चीजें हैं जो हमारे यहाँ यूजुअली नहीं कही जाती हैं.
Very good, very good. Our this is what I expect from all of you. These are the things which are practical, very important, in fact. Okay, anything else? Yes, very good. Any idea? Ali always gives answers very nicely. Why don't you? I expect the same from you. Even though you talk in Marathi, it doesn't matter. Marathi, Hindi, English. Any other idea? This topic we'll discuss in tomorrow's session. Tomorrow's session will be only dedicated for these qualities of homeopathic physicians and which are necessary in order to furnish case. And out of which the most important part will be the communication skill. So thank you being there today. Tomorrow we'll meet at the same time and with this topic only. And this topic will be very useful for in your practice, because that gives you a big guidance in order to go with the cases. Okay. Thanks a lot, everyone.
Thank you, sir. Thank you.